So the neurological assessment, there's actually a lot that we do to assess. The inspection is most of it. The mother's history is very, very important with the neurological assessment. We need to know any kind of infections that she has or anything she's been exposed to, because that affects the baby. Any hypertension, and obviously birth trauma, any hypoxia. So what the birth was like, and usually if you're admitting the baby, you were in the delivery room, but sometimes you're not. So then you inspect the baby and you look at how alert the baby is, whether the baby's crying, sleeping. Are they easily aroused? Can you wake them up, or are they kind of just kind of out of it? And then the motor activity, their tone, hypertonic, hypotonic, and then we look at their reflexes. So it's really all behavior and movement that is really important. It's not as easy to assess as adults. And then eye opening, if you can get them to open their eyes, very, very, very young, low gestational babies, their eyes are fused, so you can't. But if you can get their eyes to open, you want to look at their pupillary response. And then there are primitive reflexes that all babies are supposed to be born with, that are supposed to go away later on, but they're all supposed to be born with. And so there are 6 that we have on our sheet that we look at, and those are rooting. So we're supposed to, you're supposed to go like this, and the baby should be turning towards your finger. Obviously, again, like we, to check even for their palate, you stick your finger in their mouth, and they are supposed to just instinctively suck. And then the Palmer grasp, which all parents love. You just stick your hand in their palm and they hold onto your hand. That's just a reflex. And then the plantar grasp is when you put your hand on their foot and then their toes kind of spread like that. And then the Babinski reflex is to take your finger up their foot and then their toes kind of spread out. They just kind of go like this. And then the other one is the Neuro reflex, which is the startle reflex. That actually takes a very long time to go away. So if they hear a loud noise, then they just kind of startle awake. And so those are the reflexes that stay around for a long time, but they should be present at birth. So we always kind of check those off as being normal. The other thing we look at is abnormal jerky movements. And signs of seizure in a baby are completely different than in an adult. So lip smacking, excessive yawning, excessive sneezing, those can be symptomatic of seizures. They can also be symptoms of hypoglycemia, but also high-pitched crying is a symptom of neurological damage. So those are some of the things that you look at neurologically.